Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the gastrectomy complications, we have other complications due to impaired absorption. Okay, whenever there is impaired absorption can occur, remember one, impaired absorption of fat. Why is there impaired absorption of fat? This is because there is inadequate, actually, in the stomach, from the stomach, the food reaches the duodenum, and from there in the duodenum there will be mixing of pancreatic lipase and bile salts occur with the ingested salt. But here in gastrectomy there is inadequate mixture of the bile acids, bile salts, and pancreatic bypass occur. Pancreatic juices are inadequately mixed mainly because of the gas duodenal bypass. So whenever the food directly enters, see, food from whenever you do a Bilroth 2 especially, here the food is entering directly into the jejunum, and the bile juices and pancreatic juices are coming like this. So as a result, the mixture is not adequate, and this will result in impaired absorption of the fat. Okay, whenever there is impaired absorption of the fat is excreted in the stools, which is called as steatoria. Okay, so this is first complication. Then fat is not just fat, even there are fat soluble vitamins. Fat soluble vitamins uptake is also impaired because of impaired fat absorption, and thus the patient will suffer from deficiency of fat soluble vitamins are deficient. Okay, next. Now, because of the gastric resection, even the patient will have deficiencies in calcium. These deficiencies in calcium will lead to osteoporosis and osteomalacia in the patient. Similarly, right, if the fat absorption is present, if fat absorption is present, then the calcium will bind to the fatty acids and it forms calcium salts. And this formation of calcium salts will inhibit or will cause calcium malabsorption again. And it will result in calcium malabsorption. Right. So, how are you going to treat this calcium like osteomalacia and osteoporosis? So you should give calcium supplementation is given along with vitamin D to the patient. So there can be calcium deficiency, fat soluble vitamins deficiency, and finally fat loss can occur in steatoria in a patient with after gastrectomy.
thank you and thank you for watching.